Good morning, ma'am. Good morning, classmates. So, today our topic is about platelets. So, platelets are small cell fragments in our blood and also called as thrombocytes. Platelets are particles that bring about the process of clotting. These are probably not cell but a cell's product. Platelets are produced from a very large bone marrow cells called megakaryocytes. So, what is the function of platelets? So, hemostasis, a spontaneous arrest of bleeding from injured blood vessels. So, platelets play a key role in hemostasis, forming a temporary plug. Therefore, if you have low platelets, you are enabled to form a temporary plug and tend to bleed more easily. So, in clot formation and retraction, so it's play an important role in formation of intrinsic proton beam activator. So, it normally occurs when there is damage to a blood vessel. Platelets immediately begin to adhere to the cut edges of the vessel and release chemicals to attract even more platelets. So, next is the construction of contractile proteins in actin, myosin, and thrombocytin. So, it activates platelets, transduce contractile force onto the fibrin network of a thrombus, which over time increase clot density and decrease clot size. So, lastly is the defense mechanism. Due to the property of agglutination, platelets are capable of phagocytosis. Platelets activate and initiate their antimicrobial host defense by sensing the presence of pathogens or inflammation through immune receptors. So, here are the contractile proteins, the actin and myosin that works together to generate pores. And the other proteins that belongs in repairing to the damaged blood vessels, the fibrin stabilizing factor, important in blood coagulation, platelet-derived growth factor for growth of vascular endothelial cells and fibroblasts, and lastly is the bone Willebrand factor for platelet adherence. And the structure and composition of platelets are small plates-like, no nucleus, 2 to 3 micrometers in diameter, and also classified as cell fragments produced by megakaryocytes. And usually platelets are known as colorless, but when you see it on a microscope, it turns out blue or purple in color when stained. So thank you for listening.
This video shows the causes of platelet activating and clotting. Platelet activating factor is an endotoxin and cytokine induced phospholipid mediator. It enhances vascular permeability, promotes platelet and white blood cell aggregation, and has a negative inotropic effect on the heart. Platelet disease. Platelet disease is a hemorrhagic disease caused by platelet quantity or quality defect. Normal initial hemostasis requires a peripheral blood platelet count of more than 100,000 mm and normal platelet function. Platelet count represents the balance between the rate of formation and the rate of loss or peripheral distribution. When body's immune system function abnormally, especially in idiopathic or thrombocytopenic purpura, it can lead to destruction of platelets, resulting in reduced symptoms. Thrombocytopenia may be primary immune. Thrombocytopenia, aplastic anemia, myelodysplastic syndrome, systemic lupus erythematosus, rheumatoid arthritis. Pharmacologic treatment of thrombocytopenia. 8 of patients with idiopathic thrombocytopenia are mainly treated with glucocorticoids. and gamma globulin is mainly used in patients with extremely low platelet count and high risk of bleeding. Cyclophosphamide or hematopoietic stem cell transplantation is an option for those who do not respond to treatment.